Good afternoon, council members. Welcome to the second day of the 425th meeting of council. This meeting is traditionally focused on the elections to the executive committee, which took place yesterday. Today, we will have a short 2-hour business meeting. There are some issues that need council's input and also to provide an update on ongoing initiatives. Now I will turn it over to Dan Faulkner for the land acknowledgement and the roll call before I make a few remarks. Dan?
Thank you, Sandy. In this virtual space, we wish to acknowledge the land on which our college sits. For thousands of years, it has been the traditional land of the Huron, Wyandot, the Seneca, and most recently, the Mississaugas of the Credit River. But with many of us so far away from the RCDSO building, we invite you to reflect on the traditional lands in your area, which are home to many Indigenous people from across Turtle Island. We acknowledge and honor the ancestors on those traditional lands we are on today. We stand in solidarity of murdered and missing Indigenous women, girls, transgender, trans-identifying, and two-spirited people. I will now do the roll call. Please unmute your mic in anticipation. I'll go in alphabetical order, starting with Nalan Bargava.
Here.
David Bishop.
Here.
Amelia Chan.
Here.
Ram Chopra.
Present.
James Colliver.
Here.
Christina Cordero.
Here.
Peter Delane.
Here.
Nancy DeSanto.
Present.
Mark Eckler.
Here.
Ellie Fisher.
Here.
Vivian Hu.
Here.
Richard Hunter.
Here.
Benjamin Lynn.
Here.
David Mock.
Here.
Joseph Richards.
Present.
Harinder Sandhu.
Here.
Gildo Santos.
Here.
Brian Smith.
Here.
Usama Solomon.
Present.
Rod Stapleforth.
Present.
Mark Trudell.
Here.
Sandy Venditti.
Here.
Jack Wasserman.
Here.
Judith Walikovich.
Here.
And Cam Whitmer.
Here.
Madam President, all are present and accounted for.
Thank you, Dan. Yesterday, this council elected the executive committee for 2021-2023. It is an honor to have been selected as the college's 61st president, and I look forward to a collaborative and engaged council as we work to ensure safe, high-quality oral health care for the citizens of Ontario. I look forward to working with my executive committee.
Just sharing that I am not on camera and I'll be on mute.
Okay, thank you. I look forward to working with my executive committee colleagues, Ben Lynn, Harinder Sandhu, Mark Trudell, and Vivian Hu, and all of council. We have numerous challenges to address, and I welcome the spirited debate and discussions. Now on to our council business. Report of the Nominations Committee, committee appointments. Following the council meeting yesterday, the new executive committee gathered as a nominations committee and worked well into the evening to develop a balanced, competency-based, and fair slate of committee appointments. You have it before you. Before we get to the motion, I would like to make a few comments. For those new to council, the college solicited expressions of interest in the fall from non-council members willing to serve on committees. We received close to 70 applications. All of these were reviewed in early January based on available positions and competencies required for committees. We had an incredibly rich pool of candidates. It gives me great pride to see the talent and interest that exists within the profession to serve the college's mandate. Unfortunately, we could not fit everyone into spots and ultimately landed on approximately 25 individuals that appear on the slate before you. We faced a similar challenge last evening. However, taking into account competencies, past committees, conflicts between committees, and your preferences, the nominations committee believes that we developed a very balanced recommendation. As per our council policy on the nominations process, I would like to note several items. 5 exceptions were made. These were made in consideration of experience, succession planning, and competencies required by each committee. Dr. Richard Hunter is recommended to be reappointed as Chair of Discipline, with a Vice Chair, Judy Welakovich. Dr. David Mock was reappointed to the Chair of Quality Assurance, and succession considerations were considered for other positions. Dr. Nancy DeSanto was reappointed to the Patient Relations Committee based on her experience and balancing preferences of other members and their committee appointments. Finally, Dr. Cam Whitmer and Dr. Harinder Sandhu were reappointed to the ICRC based on their experience, the volume of work of this committee, and the need to balance council dentist members between ICRC and discipline. Will someone please move to appoint the persons listed as non-council committee members and to accept the proposed slate of candidates before you?
Sandy, I see David.
Oh, okay, yeah, Dan, if you don't mind doing that for me.
Sure. Sorry, my mic was off. Hands again. I saw David Bishop moving
I second.
and Ram second.
Sorry, wouldn't that need 2 separate motions? Wouldn't that be preferable?
Well, we'll ask Alan Bromstein.
Good afternoon. The intent of the motion is to ensure that the individuals who are listed and who are not council members are being appointed by council as non-council committee members. And the other aspect of the motion is, of course, to adopt or to approve the slate of all committees. If there is any concern about the first aspect of that, which is the appointment of the individuals who are not council members as non-council committee members, then yes, we should split them. Historically, we have not, because there has not been issues raised about the appropriateness of the non-council committee members, as the only persons who have seen their applications were the, correct me if I'm wrong, and the previous executive committee members who sorted out the qualifications and competence of those individuals. Now, in this particular case, 4 members of the executive committee were also on the old executive committee, so that's a great benefit. So that's why in preparing the motion, I didn't split it, but quite rightly, if there's any concern about doing it in one piece because you want to question any of the non-council committee member appointments, we can split them. That would have to come first then. Course.
Right. I personally don't have any issue with the non-council members. I don't know them. But I'll rely on the dentists to make those determinations. But it's just that I just thought that it doesn't really give people an option to really make a separate decision. But
So-
if nobody has an objection, then I don't have a problem with one motion.
No, Judy, I absolutely agree with you. So why don't we do it in two? So the first motion, my suggestion would be that council approve the individuals listed who are not members of council on the slate that's been presented as non-council committee members. And perhaps we could get a mover and a seconder for that.
I see Ben's hand.
Hi, thank you. I believe there's a spelling mistake under the Quality Assurance Committee under Dr. Grace Petrakowski. I believe it's not an O, it's an I.
Thank you, Ben. We will correct that. So, Sandy, just to help you out, Alan has suggested a first motion.
Yeah.
And if Alan, you could read that again, and then Sandy, I'll turn it back to you for a mover seconder.
Thank you.
So the motion would be, and sorry, I didn't write it down. It's just coming out of my mouth. That council approve the individuals listed on the slate of candidates as presented who are not members of council as non-council committee members. That would be the first motion.
I move that.
So the mover is,
Second.
I move that.
Ram moved it.
Yes.
and
And I
a
saw-
seconder?
Second. Brian.
Okay, Brian Smith.
Any discussion? All in favor? Okay. So
Alan, would you read out the second motion?
Yes, just if we could just record the fact, was that carried, Madam President?
Yes, carried. I couldn't see everybody's faces on my screen here. I'm going to rely on Dan to do that.
Yeah,
for me.
sorry, I was looking, I saw lots of hands.
Okay,
Okay. The second motion would be to approve the committee compositions as presented by the nominations committee. I think that would be it.
okay. I'll need a mover for that, please.
I see Judy.
Seconder?
Joseph.
And then Madam Chair, you should open the floor to discussion, if any.
Okay. Any discussions at all? Seeing none? May I have a vote to approve that? So all in favor? So that's passed. Thank you, everyone. Strategic plan. We will now turn to the college's strategic plan. This represents the high-level direction of the college. It will be the typical starting point for all of our meetings. There are no recommendations for council at this time. I will turn it over to Dan Faulkner and Andrea Foti to provide an update about the 2020-2023 strategic plan.
Thank you. I only have a couple of comments and then I'll turn it to Andrea, who will give you more of an update on some of the strategic projects. But you can see in your materials that the college finalized a strategic plan for 2020 and to 2023 and identified 7 priority areas. What I have said to our leadership team and our staff on many occasions, and I'll say it to you, the strategic plan is about how we become a better regulator. So there are a number of priorities and there's a number of projects, but the bottom line is how we become streamlined, evidence-informed, and more effective at the work that we do. And we have to always keep that in mind when we think about these projects. They are projects moving forward for that higher purpose. Data, you can see, is a very big part of the strategic directions. And we have hired on a contract basis an individual coming in with some specific data expertise who's really going to help us in terms of staff, collection of data, what we need to answer those questions that make us and help us become a better regulator. And trying to ensure that we balance those 7 priorities. So what we recognize as staff and what we will continue to share with you is we can't do them all, but we are trying to make some progress on all of them. And I think some are advancing faster than others. So I'll stop there and turn it over to Andrea, who will walk you through a little bit more of the detail. And as our president said, you will hear about the strategic plan progress at every meeting, and that will drive a number of your agenda items.
Great. Thank you, Dan. Thank you, Sandy. So Council, I am looking at the Council report in your package, and that's at Appendix B. What I'm going to propose to do is just very briefly touch on some highlights. I won't cover the whole report. I'll touch on a couple of things. Dan gave you some of the background already. What you can see in the report, those of you who are returning members of Council know that just in November, I gave you an update on what 2020 looked like. And I've captured a little bit of a reminder of that, and then attached as an Appendix C in this section of the Council package. There's a recap of some of the details and the status of the projects that took place in 2020. I won't go over all of that. I think suffice to say that we did make some good progress at the college on our strategic projects set out for 2020. The pandemic was a factor, as you might imagine, and hard for it not to be. But notwithstanding that, we did make some really nice progress. We have some projects from 2020 that will carry over into 2021, but that's where I propose I'll sort of focus the rest of my comments. If you look in that section of the report, so sort of the bottom of page 9 of your package, heading into page 10, we've set out a slate of priority projects for 2021. There's a graphic there to give you an indication, and it's a combination of some projects that started in 2020. Some will start brand new in 2021. These projects will advance at different paces throughout the duration of the strategic plan, and some are intended to be multi-year projects. Just to focus a little bit for 2021, as Dan mentioned, we do have a real focus on data. That is something that is going to reach across a number of different projects and will really inform a lot of work that we do. So a couple of areas in addition to that are sort of newer projects. They are going to be located under Theme A. And just to touch briefly on what those are, one initiative that we are going to be undertaking is a continuous quality improvement initiative. This is something that we are going to, for starters, have be focused on our core regulatory functions. So our PCRA division, so conduct and investigations and discipline, QA, registration, and facilities inspection. And so each of these areas are going to be developing frameworks for how to tackle CQI in their areas. And it's going to be a combination of looking at ways we can find efficiencies and improve how we do work and processes and how to innovate. We'll also be looking to see how we can use data to ensure that we're being responsive to what we're hearing and what the experience is with our process. Another area is building on initial work we've done in 2020 on risk-based approaches. We are going to look at that work with a data lens and take a look at what impact the risk-based frameworks are having and how we can use some analytics to assess that. And then I've also captured here, as you can see, a little bit of mention of the data strategy that our new staff, Eric Dessau, is going to focus on. I just did want to make a note because I know sometimes when data comes up, some people think about confidentiality quite rightly. I have, some of you may know, I have stepped into the role of RCDSO's privacy officer, and I will be obviously working closely with Eric to make sure anything we do with respect to data really meets and continues to meet our obligations that way, as we always do. So this is really a snapshot for you about what we're looking at in terms of 2021. We did just have a meeting last week with our leadership team, who by and large comprise our project managers. They will be moving these projects ahead. As Dan said a minute ago, we will be reporting to you at each council meeting to let you know of the progress and the status of the meeting as we go forward. So I'll stop there. And of course, if there's questions, happy to help answer those along with Dan.
I see Judy's hand.
Okay, sorry about that. Yes, I realize it's not possible to do everything in any given year, but somebody made reference yesterday to the symposium that we had on access to oral health care, and I understand that that's the bailiwick of the Patient Relations Committee, and I also note that there's been no progress on that I'm aware of. I was on that committee last year and we really didn't make any headway. And I'm just wondering why it's not, I realize there's a pandemic too, but why it's not highlighted as something we're going to be doing in 2021. I mean, I don't know when is that slated to begin?
Thanks for the question, Judy. The projects that are captured in the report are sort of bigger strategic projects that we're starting new. That doesn't mean though, and I want to just be clear and thank you for raising it. My expectation is that we'll come back to the Patient Relations Committee this year and work will proceed on it. So it's not to say that we aren't intending to do any work. It's simply not listed as a sort of a one of the strategic projects, but we will continue to make progress on that, and that will come to the Patient Relations Committee, and they will continue to champion and lead that.
Okay, it's just I was just wondering because it's also one of the 7 objectives that you've set out on page 13. I believe it's objective number 5, access to care is improved across Ontario. So, I mean, it seems to me that really should, I mean, my suggestion is that it needs to be a priority. I don't know how others feel, but just thought I would make that pitch.
I just want to add a couple of my own comments because, you know, one of the things that I've been very mindful of is this is a very ambitious strategic plan. Oftentimes organizations will come up with 2 to 3 priorities and really focus on those. And I think there's a lot in there, but a lot of very important and useful directions for the college. I also think access to care is in a little bit of a different bucket from the others in that we'll only make progress on that by having very well-developed relationships with other organizations. And so part of my first few months has not only been looking across the organization and the things that we want to do and working with you on issues like governance, but really starting to build those relationships with organizations. And I think, as Andrea said, it's not lost. It's certainly one that's going to take some time for us to figure out what our actual role as a regulator will be and how we will work with organizations like the ODA, like others that will, and the other dental colleges that will really help to propel this. So it's an important question and something that we will keep on the agenda. And I think you're challenging us to make sure that we're paying attention to it, and we are.
Thank you.
I see Jack's hand.
Great, thank you very much. Just following up with Judy's comment, you know how passionate I am about access to care. We spoke about this yesterday, but there's 2 phases, and Dan is right. You know, one is a long-term approach, and that's important to develop relationships with public health and the ODA and other associations involved with public health. But we have a pandemic right now, and that's not an excuse. In fact, that is the reason why we have to do access now for those people, and not just the social people on socialized programs, but the unemployed, the people who've reduced their hours and can't afford to go to dentists, the people who have barriers because dentists just cannot see the numbers or choose to charge a PPE fee. Access during COVID is the time we should act, because not acting is harm to our patients. True, long-term access is important too, but now that we have the government's ear, now that the government is putting out billions of dollars on COVID-related health issues, vaccines especially, should we not talk to them about dentistry? Because is dentistry not important for health? This is an important priority, just as important as giving money to the seniors because of COVID. I think dentistry is very important to our vulnerable patients.
Thank you for the comments, Jack. I mean, I don't think anyone would disagree with what you're saying. It's obviously access to care is a critically important topic. I think as Dan mentioned, and obviously you know this and council members know this, access to care and trying to tackle and improve access to care is a multi-stakeholder piece. There's many different facets to it. In terms of your point about talking to government, I couldn't quite tell whether you meant, are you touching on whether dentistry is included in universal health care? I wasn't sure if that's what you meant. Certainly some of those discussions and those issues you'll likely remember from the symposium did come up. That is an avenue we can continue to explore. I think Dan touched on it. Some of the work we've been doing at the Patient Relations Committee is to try to think about how best is the college positioned and what issues can we tackle? And some of those have been around helping to support the public in finding ways to increase access. Where can they go to get dental care and oral health care if they are lower income? So there's a number of avenues. Take your point, really appreciate and respect the passion you have for the topic.
I think I saw Harinder's hand.
Yes, Dan, and I just want to make a comment. I totally understand, respect the frustration Judy and Jack are expressing. David Mock is on, and he will probably be making the same comments. It has been on our, not only RCDSO, but schools and ODA and everybody's radar. We have had a symposium in 2009 at our biannual meeting where two schools, Toronto and Western, invited all the dental schools to participate in access of care. So I totally agree with Dan and what Andrea has said. It's a multi stakeholder issue. It's I think we're going to have show patience with it. It is a very, very difficult area. ODA has a bigger role to play than probably the regulators. So I will just propose that we be patient with it.
I saw David Mock's hand.
Yes, it is. Very quickly, I want to support what Harinder just said. In particular, as I read these things, it's a particular interest of mine, the place of dentistry in the whole area of health care. And we should remember that oral infection and oral disease is directly related to the terminal event for many of the elderly and the chronically ill. And I'm going to underline what Jack said. It's particularly likely a factor in the terminal event and the care of the more severely COVID-19 people that are ill. I don't think we can do anything acutely, but I'm seeing more and more of an issue about the inclusion of oral health care as part of the larger healthcare issue. And so I just wanted to emphasize that again, that the committee carrying this forward should have that in the forefront.
Sandy, if you don't mind, I'll make one comment and then turn back to you.
Sure, thank you.
I very much appreciate what everyone has been saying. And I do think that there are potentially some shorter term solutions that we can and should be thinking about, but it is absolutely a very long-term and multifaceted area that we need to be working very closely with our stakeholder groups. But I think a couple of things will happen. We have a new committee structure. So we have a patient relations committee now that will launch with its membership. And we know that there will be more work coming to that group, including what came out of the meeting, the symposium over a year ago, which I obviously didn't attend, and I've read a little bit about it, and I'll certainly work with Andrea to start to see what we can take forward to that group. We might also, as a council, as a college, look at some of our own expectations of the members, whether that's in standards or guidance. Again, it's not a quick 1 month solution, but it's something that could be over the next year, 2 years, areas that we can explore and implement some things from our perspective as a regulator. But it won't solve all of the problems, and I know all of you know that. It will require a lot more conviction and collaboration with lots of organizations, and that's exactly what we'll be doing to keep moving that forward. But I do appreciate all of your comments and your passion for moving forward with something.
Thank you, Dan, and thank you, Andrea. Moving on to governance.
Oh, I see another hand, Sandy.
Okay.
David.
Yeah, sorry. I've working from home, of course, is always a problem. As a delivery coming to my door, I'm going to have to go off screen for about 5 minutes.
Thank you, David.
Thank you.
Okay, thank you. So moving on to governance. At the November meeting, Council approved the formation of a governance working group to study and provide options and recommendations to Council about our governance practices and structure. The decision also directed that the new executive committee and the new Council finalize the terms of reference and the working group composition. I will now turn it over to Mark Trudell to provide background to the initiative and our current status with 2 motions for your consideration. Mark, over to you.
Great. Thanks, Sandy. How's the audio? Can everybody hear me? We're good? All right. Thank you. So I have the pleasure to present some information today on governance to Council. For those of you who were, just 1 second, I apologize. A little technical problem. Okay. For those of you who were present at the most recent council meeting last November, this information is going to be a refresher to you folks, and we have provided also some updates. But for our new council members, this is going to provide a brief summary of the college's recent work on the topic of governance and an overview of our proposed next steps. This slide presentation today is about 28 pages in length. I'm going to ask you to get comfortable. I'll do my best to stay on point, and we'll look forward to moving on to slide number 2, please. So in today's discussion, I'm going to focus on 4 topics. I'll provide you with some background. I'm going to provide an overview of the work that the college arrived and carried out on governance last year in 2020. I'm going to summarize the proposed considerations for the governance working group, specifically about its composition, the scope of its work. And finally, I'm going to present some recommendations that we are going to be asking Council to approve today for the next phases of the work on governance. So on that note, let's get into it. Next slide, please. Some background. To start with, let's review the background, particularly for the new members of Council. So governance is a key priority topic in regulation. It's addressed, I think that was mentioned earlier, it's addressed in our strategic plan, in the work that is done by the ministry, and in the broader regulatory landscape throughout the country. I'll touch on each of these in the next few slides. In terms of our strategic plan, as Council knows, we approved the strategic plan in late 2019. It was launched in early 2020, and it's a 3-year plan covering the years 2020 to 2023. 2 of the strategic objectives in that plan specifically relate to governance. In particular, strategic objective number 1 is to ensure that the college's governance is progressive and is patient-centered. Strategic objective number 3 is to ensure that potential external disruptors are anticipated and they're addressed. Now, we consider governance to be a disruptor because conversations and all the work around governance in Canada and beyond is really proving to be a force for change and for reform. How about some background, some more background information? The Ontario's Ministry of Health and Long-Term Care has developed a new tool to manage the performance of Ontario Health Regulatory Colleges, including the RCDSO. So while some other jurisdictions like the UK have an oversight body for regulators, here in Ontario, what we have is the CPMF, or the College Performance Measurement Tool. It's the way that our government will be assessing the effectiveness, the accountability, and the transparency of our college and other healthcare colleges. I want to mention that in this framework, governance is a key item that the ministry is focused on. And the ministry is interested in determining what governance principles the colleges have in place. And they've asked the colleges, including ours, to provide evidence about how they and we perform on specific governance topics. So the college's initial report to the ministry is due this March. I repeat, our college's initial report on governance is due within the next 90 days. And it's essential that we demonstrate that council, that our team has put some key elements in place and additional elements that we're planning on doing. So governance is not only an important topic at the college and at the ministry, it's a high profile topic in the private sector and in the public sector. And we know that many other colleges and governments are also looking carefully at this topic. In Ontario, over the last number of years, we've seen other colleges engage, take up and engage in governance work. For some examples, the College of Nurses of Ontario was amongst the first to do this work, but they're certainly not the last. We're seeing the vast majority of colleges in Ontario tackling governance issues and developing governance visions for their respective colleges. To give you a few examples, the College of Pharmacists, the College of Naturopaths, dental hygienists, amongst others. And on another example, the government recently tabled a bill that would completely remove the election system from the Ontario College of Teachers, including changing its composition and reducing its size. So governance is a key topic, not only in Ontario, but elsewhere across the country. For those of you who were at our symposium on governance last March, we heard from Dr. Chris Hacker, the Registrar and CEO of the College of Dental Surgeons in BC. He spoke about the work that his college had been engaged in. And since last March, reforms have been introduced in BC, and specifically a number of recommendations were introduced to reform the health regulatory landscape throughout BC. Those recommendations touched on the size of board and its composition, the processes that a college has in place, and the overall number of regulatory colleges in the province of BC. The province is reducing, I repeat, BC is currently reducing the total number of regulatory colleges from 20 to 6. So many professions, including oral healthcare, are currently engaged in work to amalgamate those colleges. Next door in Alberta, new legislation has been introduced that, if it's finalized, it'll bring in a number of additional reforms. And I'll speak to that in a few minutes. On the international front, we know we mentioned the UK, but also Australia have been leaders in governance work. And they're working on new models for regulatory oversight, moving to the concept of a single regulator to govern a broad range of professions, whether it's healthcare, engineering, or otherwise. So let's keep moving and let's do a quick review of the work that our college has completed over the past year in 2020. It was a key strategic project of ours in 2020. That work was led by our registrar, Dan Faulkner, and the college's senior legal counsel, Dana Simon. We made significant strides and we reached some tremendous achievements in 4 key areas. In March, the college hosted a governance symposium where council got to hear presentations from a range of experts and a chance to engage in some small group discussions. It was a pretty dynamic crowd. Many of you present were at that symposium. Following that symposium, a small group of staff conducted some jurisdictional research to learn more about the practices and the advancements that were happening in other parts of the country and even internationally beyond our borders. Which takes us to June of last year, where council passed bylaw amendments that set out competencies as part of the eligibility requirements for dentists to serve on council. These amendments, including a new eligibility review committee, were implemented during our election yesterday. And lastly, most recently, in November, council approved specific competencies for college committees, including both the statutory and the standing committees. So still on the topic of reviewing work that we've done to date, at the November meeting of last fall, council passed a motion creating a governance working group to continue and enhance the strategic work on governance. Now, the previous executive brought to council's attention the tight timelines and that there was an opportunity to seize on the momentum of all the good work done last year by the college and all the initiatives in play in the province. So correspondingly, the executive, we recommended that a governance working group be created. However, recognizing it was November and that both the previous executive committee and council were mindful of the fact that given it was the end of the year, an election was fast approaching and potentially a changeover in the council members. So accordingly, we decided that both the precise scope or terms of reference and the composition of that governance working group should be deferred and established by the new council, the new executive present today at this meeting, which brings us really to where we're at today. So the governance work isn't done and it's just getting underway. And hearing all that's happening both here and across in Ontario and across the country, let alone internationally, and the fact that our own Ministry of Health is focused on governance, there's a lot of work to get done. And accordingly, the strategic project on governance for 2021 is going to build on the previous good work that was done, creating a governance working group as a key component. That group will take up the challenge, and one of the main project goals for the governance strategic project is to develop a vision, a governance vision for the college. So the initial goal of the working group would be to create a vision by doing some groundwork, foundational work, and to discuss and make recommendations to you, council, for governance reform. That group will bring forth a proposed vision for your consideration. So now that we've done an overview and reviewed the previous work on governance that the college has done, leading to the creation of a governance working group with the goal to create a vision, let's talk about some of the considerations for this working group, the details. So when council passed the motion last November in 2020 concerning the creation of this working group, the supporting materials from the executive committee set out that the future vision should consider diversity, performance evaluation, structure and composition, guiding principles, and infrastructure. And as was contemplated by last year's council, we're here today with some more details that need to be approved by you folks, members of the current council, in order for this working group to get underway, to be empowered with terms of reference. This includes information about scope, terms of reference, composition of that group, the working group, competencies for a person to serve on that working group, similar to those that council established for other committees. And finally, we're going to put forth a recommended slate, and we will have some names for you to consider today in a few minutes. So let's talk a bit about this vision that we're going to entrust the working group to come forth with a draft. The proposed scope, which is referred to as the terms of reference. The initial goal of the working group is to develop a set of vision, including the creation of transparent guiding principles to help shape the strategic direction of governance modernization at the college. We expect that at a minimum, the guiding principles will be presented to council for consideration, likely in May at our May council meeting. The working group's also going to consider additional factors to promote a competent and diverse council, a council made up of public members and dentists. They'll look at feedback from the Eligibility Review Committee, the Elections Committee, information from senior staff of the college. They'll look at best practices from the jurisdictional review with a view of further enhancing those processes. The college is also going to have to develop a performance evaluation mechanism for council, committees, and members and chairs of committees. And that's, quite frankly, that's a requirement, fundamental requirement of the CPMF, the performance measurement framework that the ministry has put forth. And lastly, developing an infrastructure for the RCDSO to manage governance issues going forward, meaning what's the best way to streamline this work, this governance work, looking at various committees that exist in our legislation and bylaws. So continuing on this topic of scope, and folks, I'm getting there, so please bear with me. We're just about there. Concerning the scope, the working group's going to delve into jurisdictional research that was recently undertaken by staff, and it's going to consult with its own experts to determine options for models of governance for this college. The working group will consult with and will seek input from the executive committee and will eventually come up with a preferred option for reform with accompanying rationales that it will be presented to you, council, for your consideration and your decision. And we expect that many of those initial recommendations will come forth at the May meeting as well, and also further into the year in 2021. So, issues in assessment. As part of this scope step, the working group is going to assess the current state of council and committee work against emerging best practices. The group's going to analyze governance models and options and recommend to council a preferred option for reform. These issues in the assessment stage are expected to include at a minimum the size, composition, and formation of council, competencies for council, both competencies for professional members of council and public members, enhancement of eligibility competencies, and some boot camp candidate eligibility courses. In other words, getting everybody up the ladder to a level platform in terms of a knowledge base, a book of knowledge in terms of skill sets, to have a balance in terms of competencies. It'll also deal with put forth term limits, succession planning, which we spoke to earlier, and the new roster of committee members. It'll deal with committee membership and whether it should be independent from council. I repeat, committee membership and whether it should be or not independent from council. And finally, and equally important, if not more important, is equity, diversity, and inclusion issues, including equitable remuneration of council members, obtaining and recruiting diverse, racialized, and underrepresented perspectives that are more really reflective of the fabric of the Ontario community, of society in Ontario, and reflective of the fabric of the dental profession as a whole, and provide some training for council and committees. Next slide, please. In December of 2020, all members of the new council were surveyed to indicate their interest in serving on governance working groups. And if you were interested in serving, you were asked to detail the competencies that you put forth, that you bring forward. I'm pleased to announce that the interest in serving on this working group was extremely high, much greater than we anticipated, with 12 people wanting to serve, which really speaks to this council's commitment to and desire to be engaged in this important work. 12 people, essentially half the council. In order to bring diverse perspectives and the necessary expertise to this working group and to keep that size manageable for regular meetings, it has been suggested that the governance working group be composed of the following: 2 dentist members, 2 public members of council, president ex officio, up to 2 external people who have significant expertise in regulatory governance, and 1 member of the profession at large, not a member of council, but a member of your profession at large. So to increase the transparency and the accountability factor, the college will create competencies to serve on all college committees. Given the importance and the high profile of this working group, so included in the terms of reference are proposed competencies for members of the working group for your approval by council, much like the ones that were approved previously last year for the standing and committees and the statutory committees of the college. The headers for these competencies are in the information that has been forwarded to you already. I think it's an appendix attached as Appendix D to the briefing note on governance. And they're set out on this slide. Next slide, please. So in doing its work last night, and again early this morning, folks, the exec committee was hard at it. I think we adjourned at around 9:30, and we were back on the wire this morning shortly after 8 a.m. In doing that work, and including considering all the submissions from council members who want to serve on this working group, our nominations committee considered the draft competencies, looked at the roster of interested persons, and is putting forward the names of the council members that you see on this slide in front of you. Now, I'm going to share with you, it was a really challenging task since, as I mentioned earlier, half the entire council applied and expressed a desire to serve. And the talent pool, the submissions, the write-ups, the competencies were very deep. So for those of you who are not on the working group, truthfully, your skill sets are huge. You have tremendous resources to offer. And I'm bringing to your attention, I want you to keep in mind that council as a whole will be making decisions on the recommendations that are going to be put forth by this working group. So to the extent that your name is not on that slide, as a member of council, you will be participating and making decisions on recommendations put forth by that working group. And as a result, the skills that you have and your interests that you conveyed and the insight and the thoughtfulness that you have you will have the opportunity to have your voice heard and to be included in those further deliberations at this group table. The nominations committee is recommending that candidates for the external position and for the member at large position will be considered by the executive committee at our upcoming meeting in February. So the decisions for council today. It brings us to this point. We have some decisions to be made, building on the information that has just been presented to you. We will provide you the decisions in the form of 2 recommendations. As a member of council, I'm presenting to you these recommendations as 2 motions for your consideration. The first motion, which is referenced on the screen as recommendation number 1, is as follows: that council approve the terms of reference for the RCDSO governance working group, including composition of the committee and a list of competencies as set out in this briefing note. Sandy, if you'd be so kind, I'm prepared to move the motion, but can I ask you to call on a seconder and to manage the discussion, please?
Sure, thank you. So Mark is moving. Do I have a seconder? Dan, you'll have to help me with the screen.
I see Vivian.
Any discussions?
Yes.
That's Peter.
Yes, Peter.
Peter. Yeah, given the importance of this committee, of this working group rather, given the fact that these are going to be some of the most significant changes to council since the passing of the Regulated Health Professions Act in 1991, I want to be clear just what type of communication there's going to be, what the line of communication is going to be from the working group. Is it working group to executive committee to council? Is it working group directly to council? Because I think council, for something like this, I think council should be kept right up to date on what's happening. And if we have to wait for minutes, adopted minutes of meetings, that's going to take way too much time. My suggestion would be to have highlights directly from the working group to the council, just to keep members informed. And somehow it'd be great if something like that could be written in to a motion, just to make sure that the communication is rapid and timely. Thank you.
Sandy, it's Dan, could I just make a suggestion?
Yes, please.
Peter, would it work for you, you raised this, if the motion stayed the same, but within the minutes, it is recorded that there should be some real attention paid to how the working group communicates with council? It will be in the minutes, but not necessarily in the motion.
Yeah, no, that would work great too.
Okay. I'm searching for other hands. Judy.
Yes, thanks. In response, first of all, I want to thank you for including me on the committee. I'm very pleased. But aside from that, I mean, this council doesn't meet that often. So I agree with Peter that particularly when significant things are happening, that the committee, the working group will have to develop some communication protocols in order to ensure that council is kept up to date in between its meetings.
Yeah, I think that those are all fair points. And part of the reason why we wanted to respect council's decision from November in terms of getting the new exec and the new council to weigh in on this, we wanted to do it fast as well, because this council doesn't meet until May. And so we couldn't wait to start the work in May. We really wanted to start the work now. And I think it's really important for all of us, including the new executive, to consider how these issues are communicated effectively and regularly to council. I think we heard that a little bit yesterday as well. Mark, you had your hand up, I think.
Thank you. Thanks, Dan. I just want to acknowledge from my part, Peter's recommendation and for the public record, support that recommendation. I also, Dan, feel that the measures that you're proposing to ensure that that recommendation is acknowledged and put in force, I support also, Dan, your suggestion. And I think it's comforting to know that Judy, as a member of that committee, is going to ensure that that those concerns are addressed. Thank you.
I don't see any other hands, Sandy.
Okay. So
Oh, I'm sorry, Brian.
Thanks very much. I too join with Judy in her comments and others that very pleased to be recommended to be a part of this very important committee. And maybe just to add or build a bit on the comments that have been made about the timeliness of keeping everybody informed. You know, if the governance working group meets, and I would suspect they would be meeting quite regularly, then information could be imparted to everyone following the meeting as to what is happening and what's going on, and also invite on an ongoing basis people to comment back to the committee on what they're seeing and reading. So just a couple of thoughts there, but I'm very pleased to be part of this. Thank you.
Rod. You're on mute, Rod.
Sorry, thank you. Sorry about that. You beat me to the punch, Brian. I was going to suggest that distributing the minutes of each meeting to council would be quite appropriate.
Thank you.
Peter.
Yeah, just a comment about the minutes. The problem, as I see with minutes, is it sometimes takes months from either working groups or the executive committee before we at council actually get the minutes. My suggestion would be to do something very similar to what we do with members after a council meeting. So this council meeting will generate minutes. Probably early next week, every member, every dentist in Ontario will get a beautiful summary of this meeting, not the minutes, but a nice summary that they call highlights. So what we need to do is maybe develop more highlights, different divisions. We can have highlights of the executive committee. We could have highlights of the working group. But the idea is let's keep members of council up to date on what's happening so that things don't kind of get dropped into your lap at a council meeting where you're forced to make a decision on something that you've just heard about. And I think if everybody's up to date, in the interests of transparency, the highlight idea would be fantastic.
Judy.
I'll keep it brief. I agree with Peter, and what I was thinking of is that the committee or the working group will need a communication strategy of some sort. And I also actually agree with Peter that perhaps we need that same kind of a strategy from the executive committee. So I'm fully in agreement with all of that. Just wanted to put my 2 cents in.
Thank you. And we will definitely take that back. I'm going to turn to Alan Bromstein in a moment, but I mean, we're hearing loudly and clearly as staff that we need some kind of communications plan wrapped around this. This is a very important topic, obviously. Council's fingerprints need to be all over this. And so we can look at the different methods to communicate and not to be in a situation where you feel like it's a rushed decision, that you have information along the way. So I don't know exactly what those methods will be, but I think we've heard a number of good ideas today. Alan?
Well, 2 comments, and I was just going to support Peter's comments. Our minutes of our meetings, in accordance with the protocols we developed, do not talk about discussion. They deal with actions. And I'm not sure council would be satisfied with just the minutes of the meeting. So I think the people who are on the committee have heard council indicate that they want more than that. They want to understand what is going on, and that could be addressed in a subsequent discussion, I guess. I also noted that there is no chair of this committee. I don't know whether you, and maybe I missed something, but I don't know whether the executive committee intended to appoint a chair or they intended to have the right to appoint a chair once they knew all of the people who would be on the committee. So those are my comments.
Mark Trudell, do you want to address that?
Great, thanks, Dan. With regard, Alan, thank you for the comment regarding chair. That topic was discussed at the executive meeting this morning, and it's a valid suggestion. We reflected about the fact that this was a working group and not a committee unto itself. And we thought that the working group collectively as a team, that they would within themselves put forth or speak to the coordination, who takes the lead on what subject, who takes responsibility as for communications, for example, to address Peter. What are the details and the mechanics? And truthfully, we felt we would entrust that and leave that with, to my recollection of our discussion on the exec this morning, leave that with the working group to resolve, as opposed to, at this juncture, particularly when this working group hasn't been completely populated with respect to the participants that are outside council, we thought we would certainly defer on the discussion regarding and not impose at this stage a chairperson.
If I could just, sorry, was that Alan?
If I could respond. So I think it makes a lot of sense that the holding off to designated chair until after you have the governance working committee fully composed, but it might be advisable to provide that the executive committee can designate a chair after the governance working group is fully composed. I think the most important thing the chair does, quite frankly, is to arrange for the meetings. Because in our bylaws, it's the chair who has the responsibility to arrange for the meetings of the committee. I just want to make sure someone has that responsibility so things move forward in an appropriate timeline. So my recommendation is that you perhaps add as another motion after you deal with the one that's on the table, that the executive committee designate a chair after the governance working group has been fully composed.
So I don't see any more hands. I think, Sandy, I'll turn back to you. There is the motion on the table, and you can call the vote, and then we can proceed as Alan suggested.
Okay, so on recommendation from Mark, we had a mover and a seconder. All in favor?
I see lots of hands, Sandy.
Okay. So any abstentions? So then that.
No.
So then that motion is passed. And then the second
But we're just
motion.
going to put it back up on the screen.
Okay. So recommendation number 2, that council approves the following council member appointments to the RCDSO Governance Working Group as follows: Richard Hunter, Brian Smith, Osama Solomon, Sandy Venditti, Judy Welakovich, and approves discretion for the executive committee to appoint the external participants through a selection process. May I have a mover for that?
I move.
Seconder?
Ram.
Any discussion?
Ram and Mark Eckler, seconds.
Any discussion? I'm going to assume the people on the group are going to abstain from voting. I will call for the vote.
Chair, in doing so, could you ask for those in favor, then those opposed, and then those who abstain?
Okay. So those in favor? Any opposed? Any abstentions?
Yeah, so the abstentions are those on the committee, I believe, Sandy.
Okay,
And Angie, who are capturing the minutes.
so then that recommendation has passed. Thank you, everyone. Thank you, Mark, for a great presentation.
Yeah, you go ahead, because I was going to ask about the other motion that Alan
Yeah.
had suggested.
I think we should deal with that. And then, Mark, was there more to your presentation?
I was just going to bring some closure, but nothing critical.
So, Alan, what's your proposal for that last motion so that Sandy can put that on the floor?
So I would suggest that if anyone felt it appropriate, that a motion could be made that the executive committee designate a chair of the governance working group after the group has been fully composed.
So we need a mover for that, please.
Rod?
And a seconder.
I think it was Mark.
All in favor?
Can I just ask that we have some discussion?
Okay, sorry, discussion.
Okay, so I agree with the motion, except that I don't, if it requires full composition, is it required that 2 external and 1 external professional be on the committee or the working group, or are those decisions that the working group will be making in terms of deciding when the composition is complete?
I'm sorry, I'm not sure I understood the question, but Mark, if you did, go ahead.
As I understand your question, Judy, is who's making the call regarding the populating the balance of the working group with regards to external members, external of council. I believe we're working on the understanding is that the executive has taken upon itself to seek that those individuals, including the expertise, the minimum of 1, if not 2 outside experts, and rather than burdening the working group with that responsibility.
Okay, well, that's good to hear. So I guess the executive will determine when the composition is full. So if you decide that you can only find 1 expert, or you decide you only need 1 expert, whatever the issue, then that would that at some point the executive will determine that the committee is, or the working group is fully populated.
Yes, that's
That
correct.
is correct.
Okay.
Yeah.
That is correct.
And if I could just elaborate, there were, as Sandy said earlier, a number of people who applied for non-council positions, and there were several who had experience and some expertise in governance. They'd had some different opportunities. That's the group of people that we'll be looking at. So it's not another call. It will be from those 70 or so CVs and applications that came in earlier. I saw Jamie, sorry. You're on mute, Jamie.
My apologies. Presumably, the chair to be appointed within the working group will come from council members, as indicated. Is there any need to elaborate on that point? Or is possibly one of the external people, could they be chairs?
I think, it's Ellen Bromstein, any person who's a member of the committee can be appointed chair by the executive committee. They would look at the competencies of the individuals and determine who they thought might be the best chair. As the motion currently stands.
Sure. Yeah. Sure.
Any further discussion?
Sorry,
Sandy, I'll add. Oh, I'm sorry. I see
I'm just
some.
wondering, Jamie, are you suggesting that the chair, that the executive be asked to appoint a chair from council, or do you have no preference? I just wasn't clear.
Yeah, perhaps I didn't phrase it properly. We're being asked to approve the working group, and I guess my understanding is to select a chair. That chair will be determined based on the expertise, as Alan has indicated, but that chair doesn't necessarily have to be a member of council. That would be my question.
That is correct.
Thank you. Thank you for that clarification.
They only need be a member of the governance working group.
And I saw Nalan's hand, and I just want to elaborate, because I don't have the experience with RCDSO in terms of working groups from the past. My concept of this working group is it will be a roll up your sleeves and really work and dig into, I'll say the evidence, but the environment and what's been happening and how to frame that into options and pros and cons of options. So while there might be a formal chair, this is going to be a working group that's really going to be involved in the issue and to dig in depth into those issues. So I just want to make sure that's very clear with this group as well, in terms of what it's going to do and what it's going to be bringing back to the group. Nalan?
Yeah, thank you. First of all, good work, Mark. I can see there's going to be a lot of work going forward, and good luck to the working group, because I don't think the job ahead will be easy. My question is one of collaboration. I thought I'd bring this up now because we won't meet again till May. If you look at the CPMF, the one word that comes to mind is onerous. There's going to be, in terms of reporting back to the ministry, it's a lot of work, it's onerous. It's not just us, it's the other 26 colleges, other 25 as well. It will be onerous for them, just like it will be for our fellow oral health colleges, the CDO, CDTO, and the CDHO. So my question revolving around collaboration is, will our working group be collaborating with the 3 other oral health colleges? Is this something we should consider at this point?
I'll jump in. It's Dan. We already do have collaboration in a number of ways at different staff levels with the 3 other colleges. In terms of governance, I don't know what stage each of those colleges are at, but they've definitely been talking to their councils about this work. So I meet regularly with the registrars of the other 3 colleges. I think that from a timing perspective, RCDSO will want to move this along because I do think that there are risks in not having these discussions. But if we can time something that works with the other colleges, we'll see what's possible. But I don't want you to leave this table thinking that we don't have collaboration with those colleges. We will continue to have discussions and see if there's some opportunities, if this work blends or if we share experiences.
Okay, thank you.
I have Ram and Jack now.
Yeah, just a comment for appointment of external member of this group. I would presume that there will be consultation between the members and the executive committee in finalizing those members, external members.
So my understanding from what's been said is that the motion is for the exec to have the discretion to finalize the 3 members. So I'm not sure if I've understood your question, but when those 3 members are finalized, then we will certainly be happy to send a note out to the council to know who they are. Did I get your question right, Ram?
What I wanted, that when external members are appointed, before they are appointed, there should be some consultation between the members we just appointed our group, so that they know exactly who will be and what their backgrounds are.
I think I understand.
External members.
I think I understand the issue, Dan, but as the motion now reads, that would not be required. In other words, to put it bluntly, would the executive committee have to, for example, communicate with Richard Hunter about their potential choices for the external persons before they appointed an external person? And as the motion now reads, they would not be obliged to. I mean, they could if they wished to, but they would not be obliged to.
I had Jack on the list as well.
Yes, thank you. Just a comment first. I know the executive committee will choose the members, the dentist at large and the other external members based on competencies. Can higher consideration be given to an active general dentist for that dentist at large position? That's a comment. I can't direct them, but I can certainly ask them for that extra consideration. And just a clarification going back to what Peter had said, is I'm just a little confused. I know we're going to get reporting, not minutes, but some kind of review back to council. But will the actual reporting of the working group go to council or executive committee?
I think Mark said this at the beginning. This
Okay,
is
sure.
This is a council decision. So there may be some work through the executive in order to float ideas, float options, seek clarification, but ultimately council will discuss this in depth and make final decisions.
That's fine. Thank you.
Okay. So I've lost track of whether we are on a motion or whether we're done. So Sandy, I'm not sure if you have the status.
I thought we had a mover and a seconder. We did our discussion. So now the motion is on the floor for a vote. So all in favor?
I see lots of hands.
Any opposed?
None?
Any abstentions?
None.
Okay, that's passed. Thank you.
Okay.
Moving on to COVID-19 guidance. This is for information only. We would like to provide an update on numerous issues and directions emerging for the profession and safe practice with respect to the pandemic. I will turn first to Andrea Foti and then Dan Faulkner.
Thanks very much, Sandy. So Council, just as Sandy said, you've got the briefing note in your package. It starts, it's at Appendix D, and it starts at page 90. Really, the goal of this is to make sure we can keep Council up to date of the work that is happening with respect to COVID. As you probably can all appreciate, this is a very fast-moving file. There's lots of different developments that we need to respond to quite quickly. You've got some background here, setting out a few of the ways in which the college has been staying on top of this issue. As everybody knows from the news and different information from the province, we're right in the heart of the second wave of this pandemic. There's a couple of bullet points set out as to sort of what that is comprised of. You know, we're seeing obviously very high case counts, high death count. We now have the UK variant in Ontario. I just saw on the Globe this morning that they're reporting a very concerningly high rate of the UK variant in one long-term care home, I believe just near Barrie. So certainly these factors led Premier Ford, as you know, to declare a state of emergency. In terms of what did the college do, the executive committee will know. We pulled them together quickly for emergency meetings last week to turn around a revised document of our guidance that goes to dentists. And you can see in the briefing note, the main intention there was to really make sure we could have some changes to the document to make it as clear as possible to the profession what was required in this new environment, with the whole province being in a gray zone. That's based on, as you might remember, the province had a sort of a 5-column stratification in their regional approach, the most significant being gray, where there's the most stringent precautions. The whole province is in gray. So the guidance that is included in the document, and I've inserted some links, has been updated to reflect that. Couple of points that if you've seen the college's mailouts or looked at it online, you'll know that there's no change in the type of care dentists can provide. They are still able to offer the full spectrum of urgent, emergent, and non-essential. We've defined those terms. The guidance does make a suggestion that in an effort to support the stay-at-home order and reduce mobility, that dentists consider deferring non-essential care. This is a suggestion, not a requirement. And then secondly, the other feature of the guidance is that it does require dentists to use enhanced precautions for all patients regarding in-person care, whether the patient screens positive or negative. And again, that's just reflective of the fact that we are all in a gray zone. This version of the guidance will be in effect for the duration of at least this shutdown order, and as we have been doing to date, when we get different information from the province about the status and the level of restrictions that are required, we'll obviously change accordingly and update the guidance however we need to. The second piece that's set out here, and I probably won't go into a lot of detail, is just some information about the vaccine rollout. That's obviously a really key element of this work. The vaccine rollout, I'm sure you're all aware, it's something that is managed by the ministry, not the college. So the information set out here is really taken from different resources that the ministry has put together. And where I could, I've given you some links so that if you're interested to go and look at the specific detail, you're able to do that. I think a couple of things I'll just highlight briefly before I turn it to Dan is you'll see that phase 1 of the rollout is underway. They have focused on a number of at-risk individuals. Included in that phase 1 group are healthcare workers. We do know that dentists will be included in that. The specific timing that, under which they will start to receive, dentists will start to receive vaccinations is a little bit unclear at the moment. I think the first efforts have focused on residents and staff in long-term care homes as they're at really, really high risk. And I think healthcare workers providing some acute care. But anyway, this is the information about the vaccine rollout, and you can see there's going to be various phases to it, a phase 2, and then phase 3 at which the whole population will be vaccinated. So again, this is for information. I'll stop there and let Dan supplement, and of course, happy to answer questions when we come to that.
Thanks, Andrea. And I just want to elaborate on a couple of points, because this is obviously everybody is dealing with the fast pace of change in this new world, and we're no different. And it's one of those issues that really magnifies the tensions that can happen in keeping everyone informed. I want to try to bring you into the college over the last 3 months, where it seemed, and I think it's probably pretty close to the truth, every 2 weeks there was a new announcement and it changed something. It changed to the color coding system. It changed the colors or the levels of which different areas of the province were a part of, different regions. It changed recently to stay at home. And every time that happened, we would generally look at our guidance, look to see where we might make changes, if any, or provide assurance to the profession. And oftentimes bringing the executive committee together on 1 or 2 or 3 occasions to help us move it forward. And so I realize that at times we can do better in keeping council as a whole informed, but we were dealing with a clock always in terms of an announcement that something would happen in 24 or 48 hours. So that's just sort of a glimpse into what has been happening. And I think to elaborate on the most recent conversion to the state of emergency and the stay-at-home order, all through these changes, except for last March and April, I think what we've seen is that regulated health professionals, so those 26 or so colleges and probably a couple of more health professionals, have been included in the section that says they're not impacted by these changes. So they continue to be open. We've looked at that every time to see if there was something that we should do as a college. And in all cases, we've decided, no, we will follow the provincial directives and provide that advice back to the profession. In the most recent stay-at-home order, we did take some time to really look at it to say, if the government's objective is for the public to stay at home, are there services that we should advise dentists to defer if possible? And so that came to the kind of language that we used that wasn't a requirement, but it was something for the profession to look at. And I wanted you to know that we are really looking every time there's an announcement at what that might mean, what we might do, and involving the executive committee along the way. I switch now to just a couple of the relationships. We have a very strong relationship with Public Health Ontario, with the Chief Medical Officer of Health's office, with the Ontario Dental Association, and with our colleagues in the other regulatory bodies. So there are regular conversations happening at different levels with those organizations. With respect to the College of Dental Hygienists of Ontario, where there has been divergence in the guidance, we've certainly been talking that through. We've been in a state, I think, in the at least Southern Ontario and now across the province, where the guidance is quite consistent and convergent based on regional transmission that we're experiencing. But I am in direct contact with my counterpart at the CDHO. They've also been going through their own changes. They have a registrar who retired, I think, in September. They've had an interim since then, and they've just announced their new registrar who will start in February. So with those changes, I've been keeping in touch with those various individuals. I want to also just mention training capacity at U of T and Western, because it has been a very difficult environment for training programs. And some of our guidance around regional transmission, and particularly when we started by moving into the orange and red categories where Toronto and Peel were impacted, did have an impact on the training programs and the numbers that they could train, primarily but not exclusively because of the open operatory experience within those environments. But now, even more so, there are restrictions from one of the provincial regulations on the number that can be trained, where it identifies particular healthcare programs, but not dentistry. So where other health programs can actually train up to 50 individuals, and I'm paraphrasing, so there's more specific language, dentistry is limited to 10 in an environment where there is simulation or actual patient experiences that are happening. So we've been working very closely with both of the schools. That is a regulation that came out, I think, last November. The college did, through the president, send a letter to the Minister of Colleges and Universities asking for the regulation to include dentistry. I am monitoring that on a regular basis. There are others who are involved in this, in working with the MCU and the Ministry of Health, but to date, there's been no change in that particular regulation. And finally, I just want to comment on vaccines, and Andrea mentioned those. I have been, and others have been in contact with the Ministry of Health on a regular basis. The ministry has been very good about setting up meetings with all of the regulators to keep us informed about some of these plans as they're being developed and prior to them being announced. Most recently, we heard about the changes to nursing and pharmacists for the administration of vaccines. But as it stands right now, that's the scope of the expansion for health professionals. But I definitely have been keeping close contact with ministry contacts. I know the ODA is doing that as well. And at this point, they have chosen to expand, not to dentistry to administer vaccines, but to really expand within the two professions of nursing and pharmacy. So I will stop there, but I really wanted to try to give you a bit of a window into some of the experiences in the last 2 to 3 months with the pandemic and the changing environment.
Thank you, Andrea. Thank you, Dan. I just want to ask if anybody needs a 10-minute break. We have about another 40 minutes or so in the meeting. Because I know you get Zoom fatigue, so I want to keep everybody fresh and blood flowing.
I'm seeing some nods, Sandy.
So that's a yes?
Yes.
Okay. So why don't we come back at 2:45? Thank you.
Okay.
Thank you, Madam Chair. It is 2:45. If members of council have returned, if you can please turn on your cameras.
Thank you, Michelle. Welcome back, everyone. So our next topic is the College Performance Measurement Framework. The briefing materials are for information only. You will recall that the CPMF is a reporting mechanism to the Ministry of Health and Long-Term Care. I will ask Dan and Andrea to provide a brief update on the college's collection and consolidation of information for our report.
And Andrea and I have talked, and she's going to start.
Great. Thank you. I'm just having a trouble getting my video started, so we'll get that underway, but I will start talking. Oh, here we go. Great. Hi, everyone. So the note you have in the package gives you a bit of an overview. As with the other items, I'll just cover off a couple of points. I won't go through everything in great detail. As you know, and has been talked about a couple of times, this is work that is underway. The college started really overseeing our approach to developing the RCDSO report back in the fall. We have a really good implementation plan where we've divided up the various different elements of the framework to subject matter experts across the college leadership team. And we are working our way towards building our first ever report. So included in the note, you can see really just a snapshot of the different elements included in the CPMF. And then you have the documents themselves, the most recent versions attached as attachments A and B. Where we are essentially is with Cameron Thompson and Michelle Tremblay's assistance, we are really coordinating all of our subject matter experts. We're bringing that report together. We're working toward the ministry's March 31st deadline. We're also, as you have heard Dan say on a couple different items, this is very much a theme, we're making sure that we're really liaising well with a lot of different system partners. So there's a working group of Ontario Health Regulatory College representatives, so all of the 26 colleges. They meet regularly to compare notes and to determine, how different elements are being interpreted and defined so that there's consistency across colleges. We're doing the same. Cameron and Michelle are sitting on a working group specific to the oral health colleges, where they meet on a regular basis to discuss strategy and approach and where we can to really ensure that we're responding in similar ways and thinking of opportunities we can partner across those oral health colleges in particular. And then of course, liaising directly with the ministry as that comes up. So that gives you a bit of a picture. So we're fast at work. It's coming together. I'll stop there, and I know Dan wants to add a few comments.
Just a couple of quick comments. As Andrea said, the staff are rapidly working through all of the collection of data and writing of narrative, and we've got a real good plan that will have us well positioned to have the report done and submitted on time. I think that there are some points I wanted to make that Mark made about governance, and you will see in the reporting structure that there are some very specific requirements for governance of colleges. I would say that we are in pretty good shape for many of them, but there are some that we are not, and it is recognized that we probably won't have them in place by March 31st, but we will have a governance working group that will be focusing on those things. I would draw your attention to the performance evaluation piece, which will be a big part of the governance working group, the conflict of interest questionnaire, and I think that's some work that the executive committee and the council will have to contemplate in May, and as we approach May. Looking at the minutes for the executive committee meetings and how they are accessible to the public. And the other thing that I hope you noticed, but in some of the briefing materials today, you will see that we have a concept of a briefing note, and we're actually trying to steer conversations towards why those topics are in the public interest. And Andrea put together a template that we are using, and we'd appreciate your feedback as well. But at the very top of every briefing note, we're trying to summarize the issues and trying to inform you why this topic is important for the public interest. So all of those things are expected in the CPMF, including others that I haven't mentioned. And we will obviously be working towards all of them up to March 31st and beyond March 31st. There are many people who are working on this particular report. It will become easier as we go forward. If the ministry is expecting this every year, definitely we'll have a solid foundation. And I would also emphasize that much of the work over the last year, 2 years prior to my starting has been really foundational work. We successfully launched an enterprise information system called the Bridge that will allow programs to gather information that's helping with process, it's helping with data collection, and it will provide more integration than we had. And so I think that's a real, not only a success, but also very much an effort that took many people involved in that, because it was quite a complicated, and as you know from the budget, a very resource intense effort. So I'll stop there. CPMF is something that we will continue to talk about. We are submitting the report, as I said, for March 31st. You will get a copy at the same time or just before, but most of it will be material that is operational, and we're going to collect that information and we're going to consolidate it, and we will send it around to you as we submit it to the ministry.
So thank you, Andrea. Thank you, Dan. So there are 2 items for information.
Sandy, I see a hand. I see
Oh,
Peter.
sorry.
Very good. Dan, as a developer that, or one of the co-chairs of that project, just wondering, I was curious as to how much public input there was into the development of that framework, and if or when you might think that the public will have access to some of that information.
2 good questions. So the working group that developed the framework, it included, and I'm trying to remember, you're making me go back into about a year and a half, 2 years ago. I think there were 2 public members. One of them, Susan Davis was one of the public members on that group. And there was another public member who was with, I believe, the College of Psychologists, who was involved, both great contributors. There were also a number of subject matter experts. So these were not regulatory individuals. These were people who are involved in the measurement world. So again, it's a subject matter expertise. It's not a public in the traditional sense. But the ministry, when they had the development of the framework at a certain point, they also did have some small consultation with the public. So there was probably a lot of room to improve that or to add to it, but there definitely was an effort from day one to have public involvement in its development. Second question, I don't know the answer to that. I'm somewhat biased about the framework because I was involved in the development. I think it's an incredible product, and it is probably one of the first ones in the world. We know the UK has done a lot of work on this, but not in very many other places. And I have, prior to joining this college, I spoke to several different jurisdictions about the framework with the permission of the ministry, and there's great interest in it. So I don't believe it's public, but I believe if anyone wanted it, they could write to the ministry staff and would get it, but it's not on a website yet. And I don't know all the reasons for that, but I can certainly try to get a bit more information. I hope that helps.
Dan, if you don't mind, just to chime in as well. Peter, I don't know if this would be helpful or of interest, but I think it's in the briefing note, but just in case not, there is the intention of the ministry to make all of the reports they receive public shortly after they receive them. And then we as a college have committed also to making our report public. So certainly the report itself, all of the data will certainly be public.
Any further questions?
I see, I think Rod, you had your hand up?
Yes, thank you, Dan. Andrea, excellent work on the strat plan, by the way. Congratulations. I notice item and priority number 6 is to build better engagement with patients and dentists. My question is, and it's maybe not easily answered, but to what extent does the CPMF complement what we're trying to achieve under that priority? And this is going to drive significant resource to complete the CPMF. Do you feel that may jeopardize some of the things we're trying to achieve under building better engagements with patients and the public and dentists and external parties? Or do you think that there's supplementary things we should be doing in order to drive that initiative?
Thanks for the question, Rod, and for the comments. It's a really great point. I would say one of the things I'll comment on is that we do, and I neglected to mention it actually when I did the strategic plan presentation, we do have a specific project that is targeted on stakeholder analysis. And that is going to be a project that will look at ways that we can build our stakeholder networks. Who are the right people that we need to be including and ensuring we're engaging with? That's one tiny element of how we can move forward on that imperative to drive engagement. That's going to be happening this year. I mean, I think your question about will the CPMF, I heard you sort of ask two things. Will it compromise or affect negatively our ability to do some of that work? I don't think so. I don't really see it that way. There's obviously workload and capacity issues, which we're juggling, but that's the nature of work these days. And I think it's not limited to the CPMF. There's a lot going on at the college. So we'll need to look at how to juggle that and how to best resource things. But I think there are a number of things that we do that have a strong stakeholder and engagement element. So another thing, for example, that we're going to be focusing on is how we can look at social media and engagement online in terms of digital engagement. What does that look like? So these things will happen in tandem. I don't see the CPMF negatively impacting that. I don't have, if this is a long framework, and I'm going to just confess, I don't have all of the elements committed to memory sufficiently to say to you, this is the way that they tie in, other than to say there are elements in the CPMF, I know for sure, that do speak to engagement, speak to, how do we make council materials public? How do we make executive committee decision items, action items public? There's a number, those are just two things that pop to mind initially. But there are a number of things that speak to that. I think another piece that speaks to it is a systems partner measure, where it's maybe not limited or narrow to dentistry or the public at large, but it's asking about how does the public engage with a variety of stakeholders beyond the college. So I guess, Rod, I'd say suffice to say there are a number of elements that complement that objective. It is certainly our intention to make sure that we can keep at all of them and not let the CPMF report sort of, negatively affect our ability to move.
Yeah. I just joined last year, Andrea, and I remember reading initially there was some experimental research done on shareholder analysis in survey information, I think I recall. And I think I recall they were trying to figure out a way to objectify that information so they could use it for feedback and policy development. Was there, and you're nodding your head, is there any further development on that or use of that?
The one phase that comes to mind, and if Dan wants to chime in, he can, of course. But the one thing that I think we're going to be working on this year is we're going to look more narrowly at how we can build out when we do standard reviews, when we do other initiatives at the college. How can we really build out our stakeholder lists in a way that we are ensuring we're engaging with the right groups? So that is, I would say, a continuation of the work that you're talking about, Rod. So that will move for sure. I don't know, Dan, if you wanted to add anything.
No, I don't think I need to add anything on that specific point. I would say, though, just and to emphasize what Andrea has said, that CPMF is actually quite complementary to the RCDSO strategic plan. I don't think it's a shock that we have the strategic plan that we do, because Irwin was a part of the development group and we all saw what was happening in the environment. So other than access to oral health care, every one of the 6 priorities on RCDSO's strategic plan can be mapped back to sections of CPMF. So it's great, because I think, to me, and I've tried to say this internally as well, CPMF, we can't look at it as additional work. It's actually going to help us become a better regulator and be more accountable in the areas that we're doing, in the areas that we want to do, and in the areas that the ministry and others want to see.
Thank you, Dan. That was well summarized.
I don't see any more hands, Sandy.
Okay, thank you. So the 2 items for information, we have 1 new public member, Christina Cordiero, who you met yesterday, and there's a list of future council orientation dates. Staff will be contacting you to secure your dates, but if you are not able to make any of the orientation sessions, we will work with you to discuss alternatives.
I'm okay. I'm okay.
Okay, thank you. Minutes, I would ask for, we're looking at November 17th, 2020. I will ask for a mover to adopt those minutes, please.
Let's see, Joseph.
And a seconder.
Brian.
Any discussion? No discussion?
Oh, Peter has his hand up.
Okay.
Yeah, there were a few things in the minutes that I think we should revisit just for a brief few seconds and maybe get quick updates on. Let's see if there was a mention, Dan, line 446 of the meeting. There was or 457, there was a motion that you were going to revisit some of the fees of the says college fees and council member stipend bylaws to address the fiscal effects of COVID-19 on the membership. Has any of that started, or do you have an update there?
Absolutely. I won't do an update on the content, but Jeff Goldberg, our Director of Finance, and I and others in the finance area have been talking about the review since the council meeting. There has been a lot of background work developed in terms of what are all the fees, and I think it's been quite revealing in terms of the extent of fees that are indicated in the bylaws. We have also started to look at establishing some kind of principles for fees, and we've also been looking with the programs just to understand how those fees interact with the program. So we're still on track to bring back to council some options and recommendations for May.
Good. I had one more. Maybe a question for either yourself or Mr. Goldberg if he was around. But there was a mention on line 568 about, I guess there was a prediction of possibly a surplus. There was no guarantee there'd be a surplus. I'm just wondering if there was any update there. That was back in November, so this is 2 months later, if there's any news there.
So I don't know if Jeff is on, but I'll start. And if he's here, then he can obviously provide a bit more information. There is a surplus. I don't have the number off the top of my head. We also have it's unique because of the professional liability program, that there's a calculation that's done around February, March, after the year has ended, for the loss provision based on the experience and the actuarial analysis of the PLP program that also gets factored into last year's books. So we don't have that number yet, but that does have an impact on the surplus or the deficit. I don't know. Jeff, you're going to have to speak up if you are here. There you are. I am here. Thank you. I bought you some time.
Yeah, so I mean, year end is underway right now. We're still figuring out our liabilities and accruals and everything. I think it's extremely likely we'll have a nice surplus this year. The markets were up, so our pension is in very positive situation. Our investments did really strong in terms of investment income compared to what we were thinking would happen. And even though we won't have the loss provision number until the middle of March, given the fact that PLP was really just had a trickle for a few months, is probably about 25% down in terms of cases for the year. I think that will be, not as large as it's been in the past 2 years anyways. So I think indications are that the year-end results should be positive.
Thank you very much.
David Bishop.
Okay. I just, excuse me, Jack Wasserman yesterday made the comment that there was about $400,000 saving because of meetings and so forth being virtual. My dentist, who represents 2 other people and her, was wondering what's going to happen next year with fees in light of the potential that the college has a surplus.
So let me just start, because I think there was a lot of this information that was provided in November, and there are a couple component parts to your question, David. One is what Peter raised around the fee review. So as I said, there is an extensive review that's happening with all of the other fees that are charged by this college for things like the sedation program, applications, and so on. So that's ongoing. And also, and I don't have the minute directly in front of me, but it related to the annual fee for dentists, and that we would bring back some options or recommendations to council for consideration. We are, as you remember, just beyond the 3 years of fee increases that were established by council and put into bylaw 3 years ago. So now we're at a point where we need to figure out if we're going to have a 0 fee increase or a cost of living increase or something else. And what you heard in November was we have to figure out if the resources are going to support our regulatory functions. So that's sort of trying to encapsulate what was presented to you last fall from the Finance Committee from Jeff. Now I'm missing the second component part, but if Jeff wants to address any of those points, he can as well.
Sure, I'll just mention we are doing the fee analysis. The savings that we enjoyed this year with virtual meetings, that was built into the budget for this year, 2021. So we'll have those savings again this year.
The other point that just came to me, David, was part of the presentation that you saw from the Finance Committee was the operating reserve that the college needs to start to build. It doesn't mean we have to build it in 1 year, but there has to be some provision made, and that's in the CPMF as well, some provision made for an operating reserve. And I believe Finance Committee recommended and council approved that we would try to have a reserve about 25% of the operating costs. It could go up beyond that, but right now that's the goal. And the reserve that the college has is restricted to the infrastructure and IT development, which you've heard about, and also restricted to PLP because there has to be a reserve for that program. So this was also part of the use of the surplus, which would be helping to build that operating reserve.
And Dan, maybe I can just add, at the end of the year, based on those results, we'll bring a recommendation to FPA in April about whether we have some dollars to some seed money to start that reserve off.
Oh, I think that's a very good answer. And I think practicing dentists would appreciate the fact that those monies could seed the that kind of fund, reserve fund. That sounds very good. Thank you.
Yeah, last thing, Sandy, I wanted to mention. I noticed this, I can't remember if it was in the last set of minutes, but I wanted to mention it now. Next meeting, one of the next meetings this year is going to be, well, there was a date picked November 11th. And I'm just wondering if everybody on council was comfortable with that, and if there was any kind of problem as far as working that Remembrance Day for any of our members.
I could speak to that if I can. I'm involved with St. John Ambulance. That's one of our very big days that we participate in Mississauga Streetsville, where Mississauga holds its Remembrance Day service. We're expecting this year we'll be able to hold it. So for most of the day, I would be tied up with that. That's just myself, but I think we should avoid that kind of a day. It's a government day off for people with military backgrounds and so forth to reflect on our world wars and be in full remembrance. So I would make a motion to change that date to either the same day weekday to a week earlier or a week later.
If I could just jump in, we're veering off topic. I'd like to park that on the side, finish our adoption of the minutes for November 17th, and then do that as a housekeeping. Angie could look into that if everyone is okay with that.
Madam Chairman, I would support that. Just as a matter of process, I think it would be much better to approve the minutes so that if there are errors, they can be corrected before questions are entertained on the minutes. And I think there's a motion on the table to approve the minutes. There's nothing wrong with discussing what was in the minutes. It's quite appropriate, but I prefer they were approved before we had that discussion.
Okay, so we had a mover and a seconder.
Yes.
I'd like to call the vote to approve the minutes of November 17th, 2020. All in favor? Okay, any opposed? Any abstentions? Okay, that's carried. Now, in terms of the meeting date, is that something that, Dan, you can address and come back to us?
Yes, I don't think it needs a motion. We will look into that. I think the challenge will always be trying to get 25 members together. I'm really pleased that we've been able to do that for the last 2 days. If there was a reason why we needed to proceed with the date that's been selected, we would obviously look at how we honor our service members in an appropriate way during that date. But we'll look into it.
Thank you. Are there any other questions regarding those minutes?
I don't see any hands.
Okay, so before we move to in camera, in the spirit of continuous quality improvement, I'd like to take 10 minutes for a quick debrief of our meeting today. Any feedback, what worked well, any areas for improvement? So feel free to voice your opinions.
Oh, sorry, Mark.
Yeah, just want to acknowledge the great job that Michelle and her team and have been doing this from my perspective. Execution on this was fantastic. Thank you.
Thanks, Mark. I echo that as well. Peter?
Yeah, I just want to say great job, everybody from the technical side. And Sandy, congrats on the first chairing the first meeting. And I hardly noticed that Derry was gone.
Oh, that's compliments to Dan and the staff.
Brian?
Just like to join with others in complimenting everyone an excellent 2 days, and our thanks to staff for all the work that has to be done. And thanks to Mark for his presentation earlier today. That was very helpful. And congratulations, Sandy, on your first meeting and your election. Well done. Well done.
Thank you.
I don't see any other hands, Sandy.
The only other comment I would make is I believe we started, well, this was my fault, at 12:59, but the meeting starts at 1. So I think in the future, I'd like to be, because in case people are not exactly there at 1 o'clock. So that's just for me. And I think the break is helpful, keeps everybody more engaged.
Yeah.
So I'd like to move in camera. I will need a motion to move in camera, please.
Joseph,
And a seconder.
Richard.
Okay, so we are now in camera.
So we're going to take a couple of minutes, Sandy. We just
Sorry,
have to we have to close the live stream, and we have to.
We need
Sorry,
a vote on. We need a vote on the motion to go on camera. Sorry, so it's moved and seconded.
Moved and seconded.
To deal with in-camera minutes. I understand.
Yes.
But you'll need a vote.
All in favor?
Yes, I see
Okay.
lots of hands.
So we are now in camera.
So we're going to take a couple of minutes because staff will depart and we'll stop the live stream. So we'll just maybe wait 3 minutes or so and make sure that we are in camera.
For members of the public joining us, this ends the live stream. Thank you for joining us.
Thank you, Michelle.